This video is for patients with aortic stenosis and their loved ones who are thinking about treatment options to fix their aortic valve. Along the way, we will go over what aortic stenosis is and describe two different treatment procedures available: transcatheter aortic valve replacement, or TAVR, and surgical aortic valve replacement, or open heart surgery. The information in this video is meant to help you talk with your doctor about what is best for you. This video will probably answer some questions you have and raise new ones you might not have thought of yet. Throughout the video, it may be helpful for you to write down questions that you have for your clinicians.
Hello, my name is Pratiti Kazani, and I'm a heart doctor with the University of Colorado. I'm here to help you with an important decision. Someone has shared with you that you have aortic stenosis, and it may be time to fix your valve. Over the next few minutes, I will walk you through what aortic stenosis is and help you understand what your treatment options are. It can feel scary and stressful to think about a potentially life-threatening illness and making a decision about your healthcare. Throughout this video, we encourage you to think about what your goals are for treating your aortic stenosis, what concerns you have about your treatment options, and what additional questions you have for your clinicians. Let's first talk about what aortic stenosis is and how it can affect you. Aortic stenosis is a tightening of the aortic valve in the heart. This can get worse over time. Aortic stenosis makes it harder for the heart to do its job and pump blood to the body. What exactly is the aortic valve? The heart has different valves that work like doors. The aortic valve is the final exit door that allows blood to flow to the rest of your body. When the aortic valve becomes stenotic, it can't open well and blood can't exit from your heart to the rest of your body. As you can imagine, this can be life-threatening. This is what a healthy aortic valve looks like. As you can see, the valve is fully opening and closing. A healthy aortic valve is needed for the heart to easily do its job of moving blood around the body. This is what a diseased aortic valve looks like. The opening is narrowed, often by a buildup of calcium. This blockage, called stenosis, makes the heart work harder to pump blood forward into the body. Common symptoms of severe aortic stenosis include feeling tired, having trouble breathing, swelling in the legs, chest pains, or feeling dizzy or faint. You may be experiencing some of these symptoms. They may make it harder for you to do the things you really want to do.
I was actually on a ski trip over to Utah with some friends, and on the last day of skiing on a Sunday, I went up the mountain in the morning. I took one run down and determined that I wasn't going to be able to ski that day. I felt absolutely horrible, totally weak, couldn't do anything, and told my fellows that I would see them at the end of the day. Basically, spent the entire day with my head on a table in the restaurant. Just felt miserable and had no idea what was going on. I don't think I'd ever felt that weak.
If left untreated, these symptoms usually worsen over time and can lead to death. Next, we're going to talk about two treatment options for aortic stenosis: surgical aortic valve replacement, or open heart surgery, and transcatheter aortic valve replacement, or TAVR. Keep in mind that you may need additional testing so your doctor can better understand what treatment options are available to you.
Hello, my name is Joe Cleveland at the University of Colorado. I'm a doctor who performs open heart surgeries, including surgeries to fix aortic stenosis. I'm here to talk about surgical aortic valve replacement, one of the treatment options for aortic stenosis. Open heart surgery involves a heart surgeon opening the chest, usually by cutting through the breastbone, called a sternotomy, to access the heart directly. The surgeon will replace the diseased valve with a new valve.
I remember going in, for the surgery, but for some reason, I didn't really have any fear. I thought I had a good doctor who was taking care of it.
Hello, my name is John Carroll, and I am an interventional cardiologist, which means that I am a heart doctor who performs procedures to help hearts work better. I'm going to talk to you about transcatheter aortic valve replacement, another treatment option for aortic stenosis. Transcatheter aortic valve replacement, otherwise known as TAVR, is a procedure where a new valve is placed in the heart through a small tube called a catheter. During the TAVR procedure, a small incision is made typically in the groin area where a catheter is inserted into the artery. This allows the catheter to travel up the artery to the heart. Once the catheter reaches the heart, the new valve will expand, attaching to the diseased valve and opening it up. With the new valve in place, the heart can pump blood more easily to the body.
I was sedated. I was not put under with any general anesthetic.
I think I was here 3 days. I was well enough in 2 weeks to take a long road trip and do some family visiting and sightseeing. So be aware of what your body is telling you. You've got to listen. Everyone's different, and your symptoms may be different than mine, but listen to your body if things aren't going as you expect them to.
Both procedures are effective ways to treat aortic stenosis. However, there are some differences. Open heart surgery is an option for those without other severe health problems and who are good candidates for surgery. TAVR is an option for patients who are considered intermediate or high surgical risk. It can also be offered to patients who are not candidates for open heart surgery. This video is for people who are considered intermediate or high surgical risk. After open heart surgery, the hospital stay is typically about a week. The recovery time can last on average about 8 weeks. With TAVR, patients usually have a short hospital stay after the procedure. Without complications, patients usually feel better within a few days after the procedure, and the incision takes a couple of weeks to heal fully.
Many patients and their loved ones want to know about the types of valves that are used for aortic valve replacement and how long they might last. For open heart surgery, either a bioprosthetic valve or mechanical valve is used. Bioprosthetic valves are made out of animal tissue, usually from pigs or cows. Mechanical valves are typically made out of metal. Those who have mechanical valves will need to take blood thinner medication for the rest of their lives. For the TAVR procedure, a bioprosthetic valve is used. While valve replacements may last many years, eventually your new valve may need to be replaced. The timing of this is different for every patient. Unfortunately, we cannot see into the future to know how long your new valve will last. At this time, we know that mechanical valves for open heart surgery may last 25 years or more, while bioprosthetic valves for open heart surgery may last 15 years or more. TAVR is a newer procedure, and we do not know as much about how long these valves will last. They may be similar to bioprosthetic valves for open heart surgery.
And then he gave me the option of the artificial valve, which would require taking a pill every day of my life, and I already take more than one, so that seemed like a good option.
I'm 78 right now, was 77 when the TAVR was done. The valves typically implanted in the open heart procedure they last 20 years or in that ballpark, even if they don't last quite that length of time, it's not assured that I'm going to last that length of time.
Talk to your doctor about any concerns you have about how long your valve might last. Also, ask about what options might be if your new valve ever needs to be replaced. Let's talk about benefits and risks for each treatment option.
Both TAVR and open heart surgery may help you feel better and live longer. For both procedures, nearly 9 in 10 patients are still living within 2 years after the procedure, and just over 1 in 10 patients will die. Open heart surgery has been the standard of care for aortic stenosis for over 50 years, and patients often know more people who have had open heart surgery. There is also more known about how long these valves will last. Open heart surgery is the only option for patients who want mechanical valves. TAVR is considered a less invasive procedure as it does not involve open heart surgery. The recovery time is much shorter than that of open heart surgery, and it includes a shorter hospital stay. Both options have potential procedural risks, including death, bleeding, stroke, heart attack, infection, and blood clots. For both procedures, nearly 1 in 10 patients will suffer from a stroke within 2 years after TAVR or open heart surgery. Nearly 1 in 10 patients will suffer from serious injury to blood vessels, such as a tear or puncture, within 2 years after TAVR. This can happen because the catheter needs to fit through tight spaces in your arteries in order to get to your valve, and this usually requires a big hole. Most of these occur around the time of the procedure. This happens less frequently in open heart surgery. Less than 1 in 10 patients will suffer from serious injury to blood vessels within 2 years after open heart surgery. 2 in 10 patients will need a pacemaker within 2 years after TAVR. This is a small device placed in the chest to help control the heart's rhythm and requires an additional procedure to be implanted. Most of these occur around the time of the TAVR procedure. The risk is smaller in open heart surgery, with 1 in 10 patients within 2 years after surgery needing a pacemaker.
How serious these risks are may be different for some people. Talk to your doctor about individual risks. Some of the benefits and risks for both treatment options may look pretty similar. However, there are distinct differences. Here are some main points for you to take away. Both TAVR and open heart surgery are effective treatment options for aortic stenosis. TAVR is less invasive than open heart surgery. Compared to open heart surgery, there is a higher risk of needing a pacemaker after TAVR. Open heart surgery is the only treatment option for those who prefer a mechanical valve.
There's a lot to think about when trying to decide which path is right for you. The choice between open heart surgery and TAVR is a very personal one based on your overall health, values, and individual preference. Let's take a look at what patients who have been in your position have to say about making their decision.
We have 6 children, and we wanted them to be informed, and so they were aware of what was going to be taking place, and it was they had trust in our decisions, but we wanted them to be informed, and so we gave them all the information that we had received from the doctors, and so they were ready for us to go on. It's very important for people to understand that every individual is unique in their own situation, and that what might be right for myself as an individual, it might not be right for another individual, whether it's the medical history or emotional history or whatever's involved.
People who helped me most were the doctors, who were telling me what my options were and talking to me about it. What issues might occur, how long would I be having this new valve last, which they had provided me information on, going back to work and taking care of people in my family to the extent that I needed to be doing that.
I had a back operation scheduled. That was causing me a lot of pain and difficulty walking and things like that. And I knew that I wanted to get that operation done with as soon as possible. And if I had a longer recovery period, that would have pushed that operation out longer also. They said that the TAVR procedure would get me home in about 3 days. And of course, the open heart surgery would take a longer recovery time, both in the hospital and at home. I believe that the TAVR is probably a very nice option for someone like me.
I don't think individuals are doing as well when they're dealing with the unknown. And so knowing what to expect and the procedures that are going to be done is extremely beneficial to the patient and family.
In summary, you're watching this video because your doctor has told you it may be time for you to treat your aortic stenosis. We went over 2 different treatment options, TAVR and open heart surgery. While both are effective treatment options, the decision is ultimately based on what is right for you as an individual. You may need additional testing so your doctor can have a better understanding of your treatment options. You know yourself better than anyone else does. We encourage you to talk with your clinicians and your loved ones about what's most important to you when considering treatment options for aortic stenosis.
You may have more questions after watching this video. That's a good thing. This video is not meant to answer every question about aortic stenosis or its treatment options. Each person is different. We hope this video has given you some information to help you start a conversation with your clinician. Make sure you have all of your questions answered before making your decision.